Arthritis is known as inflammation and stiffness in the joints. It can cause pain, swelling, and limited mobility. It is a common problem and may occur in anybody, regardless of gender. This kind of pain may be chronic or acute and can be severe or mild, which can make it impossible to use the joint. There are different types of arthritis, such as osteoarthritis and rheumatoid arthritis, each with its own causes and treatment approaches. Proper management of arthritis involves a combination of medication, lifestyle changes, and therapies to reduce pain and improve joint function. Hello everyone and welcome back. Today, we're going to discuss an important topic for those dealing with arthritis or looking to maintain optimal joint health. We'll be exploring 13 foods that you should steer clear of for better joint health. Now, before we dive into the list, it's important to note that a balanced and nutritious diet is crucial for overall well-being, including your joints. Always remember to consult your doctor when it comes to addressing any health concerns, including arthritis. So, let's get started. 1. Red meat. Red meats are higher in fat, particularly saturated fat, than white meats and plant-based protein. Can contain high levels of purines and saturated fats that may contribute to joint inflammation. Red meat, including beef and lamb, contains purines that can be converted into uric acid, leading to joint inflammation in some individuals. Studies have associated red meat intake with increased levels of inflammation, which may worsen swelling in the joints and arthritis symptoms. One study found that substituting red meat with a serving of chicken, fish, legumes, or nuts was associated with lower inflammatory. 2. Polyunsaturated cooking oils. Do you cook with corn, soybean, canola, safflower, and sunflower oils? These oils are commonly used in restaurants and at home and are high in omega-6 fatty acids, but very low in omega-3. This imbalance can lead to inflammation, and since most individuals do not get enough omega-3 from sources such as salmon, flax, walnuts, and chia, to balance out these oils, arthritic symptoms can worsen. 3. Eggs. Regular consumptions of eggs may lead to increased joint pain and swelling. Eggs, particularly the yolks, have arachidonic acid that can result in the production of prostaglandins, one type of lipid autocoids, which will trigger inflammation in your body. In addition, eggs have saturated fat that also contributes to pain and inflammation. If you like to consume eggs for breakfast, you should skip the egg yolks and eat just the egg whites in the omelet forms. 4. Sugary drinks. Beverages like soda, sweetened juices, and energy drinks contain high amounts of added sugars, which can trigger inflammation and potentially exacerbate joint discomfort. The excess sugar in these drinks can lead to weight gain, putting additional stress on your joints. Moreover, the spike in blood sugar levels caused by sugary drinks may contribute to inflammation, leading to joint pain and swelling. 5. High sodium foods. Excess sodium in your diet can wreak havoc on your body in many ways, from increased blood pressure to thyroid malfunctioning. It also may play a role in arthritis. Foods that are high in sodium, such as processed snacks, canned soups, and fast food, can lead to water retention and inflammation, potentially worsening arthritis symptoms. A high sodium diet can cause your body to retain water, leading to bloating and increased pressure on your joints. Additionally, excess sodium can trigger inflammation, which can be particularly troublesome for individuals with arthritis. Avoid preservatives and additives. Less salt may help manage arthritis, so avoid prepared meals and limit your sodium intake. 6. Fried foods. While they may be tempting, foods that are deep-fried or heavily fried in oil can be detrimental to joint health. The high levels of unhealthy fats found in fried foods can trigger inflammation and contribute to joint discomfort. When foods are deep-fried, they absorb a significant amount of unhealthy fats. These fats can promote inflammation throughout the body, potentially aggravating arthritis symptoms. Try making your meals at home more often, so you can control what goes in them. Opt for air frying or baking instead of frying. 7. Candy and dessert. Added sugars don't offer any nutritional value. This is why they're often referred to as empty calories. Worse, they can increase inflammation. Limit your added sugar intake to those 9 teaspoons per day. Common food sources of added sugar include candy, desserts, baked goods, ice cream, processed snacks, and condiments like ketchup and barbecue sauce. 8. Processed foods. These foods are often high in unhealthy fats, sugars, and additives that can contribute to inflammation in the body, worsening arthritis symptoms. It's best to limit your intake of processed snacks, fast food, and packaged meals. Processed foods such as chips, soda, and burgers are typically loaded with trans fats, refined sugars, and high levels of sodium. These ingredients can increase inflammation, leading to joint pain and stiffness. 9. Dairy products. While dairy can be a good source of calcium and protein, some people with arthritis find that certain dairy products, like whole milk and cheese, can exacerbate their symptoms. Some individuals with arthritis may experience increased inflammation and joint pain after consuming dairy products. If you suspect dairy is affecting your joint health, consider alternatives like plant-based milk or dairy-free options. 10. Refined grains. Foods made with refined grains, such as white bread, pasta, and pastries, undergo a process that removes the nutritious bran and germ, leaving behind mostly empty calories. Refined grains lack the fiber and nutrients found in whole grains, and they can cause a rapid spike in blood sugar levels, potentially triggering inflammation in the body. Opt for whole grain alternatives like whole wheat bread, brown rice, and quinoa for better joint health. 11. Artificial sweeteners. While they may seem like a healthier alternative to sugar, artificial sweeteners, such as aspartame and sucralose, can still impact joint health negatively. Research suggests that artificial sweeteners may contribute to inflammation and potentially worsen arthritis symptoms in some individuals. Consider using natural sweeteners like stevia or small amounts of honey as alternatives. 12. Alcohol. While moderate alcohol consumption may be acceptable for some, excessive alcohol intake can have detrimental effects on joint health. Excessive alcohol consumption can lead to inflammation and can interfere with the body's ability to absorb essential nutrients, such as vitamin C, which plays a crucial role in joint health. It's best to moderate your alcohol intake or avoid it altogether. 13. Nightshade vegetables. While these vegetables are generally nutritious, some people with arthritis find that nightshade vegetables, such as tomatoes, eggplants, and peppers, can worsen their symptoms. Nightshade vegetables contain a compound called solanine, which some individuals with arthritis find triggers inflammation and joint pain. If you suspect nightshade vegetables worsen your symptoms, consider eliminating or reducing them from your diet. And there you have it. 13 foods to steer clear of for better joint health. Remember, everyone's body is different, so it's essential to listen to your body and make informed choices that work best for you. If you have any questions or tips of your own, please share them in the comments below. Don't forget to subscribe to our channel for more informative content. Thanks for watching and take care of your joints.